Today's topic is radius. Radius is the lateral bone of the forearm extending from the elbow to the wrist. It is homologous to tibia, and in anatomical position, the radius is found in the lateral forearm, while the ulna is found in the medial forearm. Here we can see in radius, it has an upper rounded end, a lower broad end with a styloid process and a shaft. Now talking about upper end, it comprises of the head, neck, and the radial tuberosity. For head, it is disc-shaped and articulates with both the capitulum of the humerus to make elbow joint and the also with proximal ulna. For radial tuberosity, it lies just below the medial part of the neck. Now talking about shaft, it is firmly connected to that of ulna by dense connective tissue called the interosseous membrane. It has 3 borders and 3 surfaces. For borders, there are anterior, posterior, and medial, which is also called as interosseous. For surfaces, it has anterior, posterior, and lateral. Now talking about lower end. It is widest part of the bone and has 5 surfaces, that is anterior, posterior, medial, lateral, and inferior. Against the anterior surface, the radial artery is palpated. For posterior surface, dorsal tubercle of Lister lies lateral to an oblique groove. Talking about groove, it has 4 grooves for the extensor tendons. First groove gives passage to abductor pollicis longus and extensor pollicis brevis. Second groove gives passage to extensor carpi radialis longus and extensor carpi radialis brevis. Third groove gives passage to extensor pollicis longus. Fourth groove gives passage to extensor digitorum, extensor indicis, posterior interosseous nerve, and anterior interosseous artery. For medial surface is occupied by ulnar notch for the head of the ulnar. For lateral surface, it is prolonged downwards to form styloid process. For inferior surface bears a triangular area for the scaphoid bone, a medial quadrangular area for the lunate bone. So this is gross anatomy of radius. Now for the side determination of radius, we will look for 3 point. First is upper rounded end, second is shaft, and the last point is lower end. So, point number 1, upper head. The upper end has a disc-shaped head, a narrow neck, and a radial tubosity on its medial side. So point number 2, it has a very sharp border located on its medial side. So point number 3, the lower end consists of a styloid process on the lateral side, and posteriorly it has a dorsal tubercle of Lister, a very prominent tubercle. This is the radius of right side. Finally, the muscle attachment. This is anterior surface, this is posterior surface, and this is lateral surface. There is insertion of biceps brachii in rough posterior part of radial tuberosity of upper end. For shaft, in anterior surface there is origin of flexor pollicis longus and insertion of pronator quadratus. In posterior surface, there is origin of abductor pollicis longus and extensor pollicis brevis. And in lateral surface, there is insertion of supinator and pronator teres. For lower end, there is insertion of brachioradialis. This is muscle attachment.
If you want the note, please comment down below.